Welcome to a quick overview of the stroke team activation here at USC Keck Medical Center. As you know, stroke team activation rolled out in October 2021, and as a healthcare provider, you play an important part in identifying and activating our stroke team on potential acute ischemic strokes. In an acute ischemic stroke, time is brain. Early identification and diagnosing leads to early treatment, which is essential to prevent further damage to the brain, as well as major disabilities or even death. The major component of stroke team activation includes the early identification of stroke. As healthcare providers, we are our patient's advocate. Recognizing stroke symptoms early can expedite possible treatments and interventions. Here at Keck USC, we use the mnemonic "Be Fast" to identify early signs and symptoms of stroke. B for balance. Watch for sudden losses of balance. E for eyes. Check for vision loss or field cuts in one or both eyes. F for face. Look for an uneven smile and or facial asymmetry. A for arm. Check if one arm is weak. S is for speech. Assess for slurred speech, difficulty speaking, or confusion. T for time. Once early stroke symptoms are identified, call the appropriate team as soon as possible. Please note, for rehab, med-surg, telemetry, the stroke team is activated through RRT. For ICU patients, the stroke team is activated by immediately notifying the primary ICU team. For outpatients, visitors, and staff, the stroke team is activated by calling code ETC. Once responding providers confirm stroke symptoms, they will then activate the stroke team by dialing 77. During the stroke team response, know the last known well time of the patient, current vital signs, glucose level, any current use of antiplatelet or anticoagulation therapy. Know the patient's medical history, such as recent surgeries, risk for bleeding, and or pregnancy. These are all essential to the proper treatment of acute ischemic stroke. If the patient is being transferred to the ICU or any other unit, SBAR can be utilized to provide efficient communication between clinicians. Here at Keck USC, we are dedicated to improving the quality of life for individuals and society by promoting health, preventing and curing disease, advancing biomedical research, and educating tomorrow's physicians and scientists. Thank you for watching.
We need you to know that hospitals in Los Angeles County are ready to treat stroke.
Stroke can be subtle but sudden.
If you or someone you know experience sudden weakness or numbness on one side of the body, confusion, trouble speaking or understanding, trouble walking or loss of balance,
vision changes, dizziness, severe headache,
don't delay and activate stroke team, because when it comes to stroke, time is brain and every minute counts.
We are here for you and mask up for you. Please mask up for us.